Hello, I'm Dr. Robert LaBelle. Welcome to Education at CCSR. Today we're going to be talking about elbow pain. There's a number of different types of elbow and wrist pain. Typically, pain felt on the outside of the elbow we call tennis elbow or lateral epicondylitis. Pain felt on the inside of the elbow is golfer's elbow or medial epicondylitis. And no, you do not have to play tennis or golf to have these. These typically are felt as a burning pain in the elbow. A lot of times, if the pain is bad enough, you can get a referral pain down the arm into the hand, even affecting the fingers. Sometimes that'll even be felt as a numbness. Likewise, medial golfer's elbow will be felt down the inside of the arm, going to some of the palm or the finger pads. Elbow pain usually presents as a burning sensation. It typically affects people nowadays much more commonly than in the past due to the specialization in workplace. As we sit at a computer and we type all day long, if you just move your fingers, Ariana, these tendons contract considerably over time and they end up developing adhesions and stiffness, and then subsequently the tendons start to become inflamed and then they break down. Along with the specialization in workplace, we then take our sedentary lifestyle and then we move into the weekend and then we perform vigorous activities such as golf, playing racket sports, or say bowling. And then we're taking the elbow and we're using it vigorously and we overload that tightened tissue and then it becomes even further inflamed. Elbow pain typically doesn't resolve itself on its own. It can if you rest it initially for a period of a couple weeks, but if it doesn't resolve, then we know that you're starting to get a chronic inflammatory condition. And that chronic inflammatory condition very often has to be treated. It has to be treated with rest, first of all. Start to remove yourself from some of the activity. As an example, if you're at the workplace, potentially think about changing your mouse or getting potentially even a wrist brace to help stabilize the arm. Treatment in office for tennis elbow and golfer's elbow is invariably active release. We will hold some of the damaged tissue and move the patient through a range of motion. This technique is aimed at releasing the adhesions and the stiffness and regenerating the soft tissue. As well, we very often will treat the tennis elbow or the golfer's elbow with a Graston tool, and the Graston tool is once again aimed at causing new tissue growth, thus reducing the inflammation and improving function.